Glue ear is a condition that commonly affects our ears. We predominantly see it in children, but we can also see it in adults. What I've got here is a model of an ear, and I'm just going to explain to you how it all works. So this part of the ear is what we call the outer ear, and this bit here is what we call the eardrum. So what tends to happen is behind our eardrum we should have air. In a situation where a patient develops glue ear, fluid starts to accumulate behind ear, and that fluid is rather thick in appearance, and that's predominantly what we call glue ear. It is very common in children, and the reason for that is the hearing apparatus is slightly immature. As we become adults, we're able to manage this more effectively. However, as I suggested earlier, this can be seen in adults too. Glue ear effectively is fluid that builds up behind the eardrum. This tube here is what we call the eustachian tube. So when we try to pop our ears by closing our nose, we force air through here and the drum pops. In children in particular, the ability of this eustachian tube to work effectively is slightly affected. And so instead of air, we have fluid building up here. The symptoms of glue ear predominantly are of hearing loss. And the reason for this is because of the fluid that builds up behind the eardrum where there should be air, less air is conducted through and the patient will complain of hearing loss. This is extremely important in children, particularly in the early stages of life where speech development is important. Any impairment of their hearing will affect their speech development and overall development. Other symptoms of glue ear could be pressure and pain. You may have seen or taken your child to your GP with a condition known as otitis media, and that's fluid that predominantly builds up behind the drum, and the drum will burst and then there's discharge. This is another feature of dysfunction of our middle ear apparatus, and again can be treated very effectively. We treat glue ear in children and adults in the same way. The patient will have a hearing test performed first. This includes an audiogram to measure the hearing level and a test known as a tympanogram which measures the pressure behind the eardrum. In a patient with glue ear, there'll be fluid there and no air behind the drum. Based on these tests, we'll then consider inserting under a short general anaesthetic a tube which is effectively a ventilation tube known as a grommet. The tube allows air to pass in for hearing and also allows fluid to dissipate out from the eardrum and keeps it dry. And I'll just demonstrate on my model here. So this is your eardrum. The tube is then inserted into one aspect of the eardrum and it stays there for up to 12 to 18 months. We'll then repeat a hearing test to make sure all fluid and glue has disappeared and that the hearing has returned to the satisfactory levels.